myself Dr. L.C. Dhoka, practicing in Sodala from last 40 years, and I am going to discuss you about the most prevalent disease now in this rainy season is dengue, and dengue is caused by a adenovirus which is called dengue virus. These are 4 types of virus: type 1, type 2, type 3, type 4. You may get infection with any one of them or any combination of 2 or 3 also. Normally it's very simple fever-like illness or a flu-like illness, or it may take 2 to 3 days and passes it off. If it occurs in a severe form, then it takes a severe turn and you may get more sick and you may get more symptoms. The common symptoms usually in first 3 days are severe sudden fever and body aches, along with joint pain, backache, headache, vomiting, pain abdomen. These are the symptoms which occur suddenly and in a severe form. But in a normal case, they remain for 2 to 3 days and then goes away. But in some of the cases, it may last for 7 to 10 days. For this, you have to contact your doctor early to analyze these symptoms and diagnose it. Because it may be similar to other viral illnesses or other some illnesses, simple flu, influenza. So you have to differentiate early to avoid the complications. For that, you have to go for the simply blood test. Blood tests are 2 types. One is the RT-PCR for dengue fever, dengue virus, and second is the NS1 and IgM antibodies for the dengue. RT-PCR can be done on 2nd and 3rd day, and NS1 can be done in the first 7 days. If it turns out to be positive, then this protein is found positive, then it is definitely a sign of dengue. But if it is negative, then dengue cannot be ruled out. You have to do in the 2nd week again NS1 and IgM antibodies. If both are positive, then it is definitely dengue, and so you should take a proper treatment. Not only this, you have to be very careful, or your doctor should be very alert in observing the symptoms which are pushing you towards the complications, like continuous abdominal pain with constant vomitings. There is on examination, there is a enlargement of liver. You are finding that water is filling in your abdomen is getting distended. Then you may find some kind of epistaxis, bleeding from the nose, or red spots on your body. Or most important symptoms, if you do blood test, then you find if your hematocrit is increased and platelet are down, it definitely a sign of warning sign that you are going for complications. Another symptom, if you are continuously for 7 to 10 days, you are very restless or drowsy, then it is also a sign of complication or a warning sign of complication. So at that time, you should contact your doctor and take the proper treatment. There is no specific treatment for the dengue, only symptomatic treatment you have to take. For the pain and fever, you have to take paracetamol continuously round the clock. And second part is the important part is the hydration. You should hydrate your body with water, oral or intravenous. Intravenous is the normal saline, or glucose normal saline is the best solution for us. Keep yourself fully hydrated. Then you have to pass 4 or 5 days, maximum 7 days, your dengue goes away. But if you are infected second time, then you are going to have antibody already in your body and you are going to have a severe form of dengue. Then in that case, you may have follow BP, there is a sudden ascites, rise in liver enzymes, and you may have complications and course may be severe. For that, again, you have to go to doctor or the hospital and take the fluid therapy or fresh blood and other treatment to treat it. It's very not difficult and very easy to treat this problem. So therefore, I request all of you to kindly be alert in the symptoms. In the clinical picture, or the alertness of the patient and doctor is required. You have to watch the warning symptoms. So you cannot go for a complication, a phase of complication, and you can be treated easily. Regarding the food, there is no specific food. Only treatment is the paracetamol, fluid therapy, and at the maximum folic acid, which helps in the regeneration of the platelets and bone marrow. Otherwise, pomegranate, papaya fruits, and milk, fresh milk, they are very good for its treatment. Regarding the unnecessary or the WhatsApp prescribed drugs, you should not use from anybody. Somebody says that the juice of the papaya leaves is good, but it causes vomiting. Kiwi fruit, it causes acidity. You should not use it in patients of dengue. Neither the SCADA or neither the papaya juice or nor the kiwi fruit. Only simple food and water therapy is sufficient. I think this is sufficient. Thank you very much.